So here we are. Here's my table of all the relative risks, and the top one, look at that, a 200 times relative risk of being female compared with being a man. So I see 2 or 3 male breast cancers a year, about 0.5%, and as soon as you see that relative risk, 200 times. But that's just because most breast cancers occur in women. And we've said the risk is 1 in 9, 1 in 10 throughout your entire life. As you get older, the risk goes up. Interestingly, people who've had breast cancer before are more at risk of having breast cancer again. Now, that's not just that they might get it on the same side, but we do see a small number who get it on the other side. So in terms of following up ladies who've had breast cancer, it's important to keep a check on both sides. I'm going to talk about the BRCA mutations in a minute, and also family history, and we'll talk about an important family history. But again, the relative risk, greater than 6, greater than 2. And we've talked about geography in terms of how I talked about the Japanese and the Western world and how environment and diet can also affect you. And then we've got this little list of the ovarian factors, you remember, but these are all relative risks. They're not absolute risks. They don't tell you that you're going to get breast cancer. They just tell you might be slightly more likely to get it, even though most people won't. So it's the age of period start, that's the menarche, the age of menopause when they stop, the age at first pregnancy, so it's higher if you have children older. We've talked about being overweight, the BMI, we've talked about alcohol and smoking. Ionizing radiation is an interesting one. Now, this is not breast cancer, this is not mammograms, beg your pardon. Remember, mammograms are low dose, but we've now recognized that people who've had a cancer of the lymph glands called lymphoma will often have had quite high dose radiotherapy, so treatment for their breast cancer that covers the chest that will involve the breast. And we know that these ladies are at increased risk, and these ladies now get early screening for breast cancer with MRI scans. So we're not going to x-ray them anymore, but they will have MRI screening for breast cancer because we know they're at increased risk. We've talked about combined HRT. The bottom line is slightly difficult. There are various precancerous conditions that we know about. And it's things like the DCIS is ductal carcinoma in situ, which is a precancerous condition that if you leave it, most people believe it will turn into cancer if you leave it over a period of years. So it's things like that will increase your risk. But you can easily see when you first look at it and you look at being female gives you a 200 times relative risk, that initially looks quite scary. But that's compared with men who tend not to get breast cancer, but we see people who do. So I hope that sort of table puts things in perspective a bit and tells you the things to be careful and look out for. But remember, again, relative risk doesn't tell you anything about whether you will actually get breast cancer or not.